My name's Claire Crowe and I'm here from Healthworks, a community health charity based in the West End of Newcastle. And I'd like to talk to you about social prescribing for children referenced in Zone West. Initially, social prescribing was focused on working with adults and for children is less well known. But countrywide, Children and Young People Services are now implementing the model. Link and Cumbria have supported over 500 5 to 19-year-olds since March 2021. Be Wild in Lancashire provide trauma-informed, relationship-based practice in an outdoor setting. And in Hampshire, No Limits are part of the triage pathway for young people experiencing low mood, anxiety, self-harm or suicidal thoughts. There are notable differences in the delivery of social prescribing for adults and children. The first is caseload. I have friends who work with adults who have caseloads of over 100, and their complaint is that they have very little, if any, face-to-face contact with their clients, coupled with the impersonal nature of discussing complex and often intimate issues over the phone. In Zone West, link workers work intensively with no more than 30 children, and we push back hard against requests to increase this number because we're determined to maintain the relational aspect of our support. Secondly is the length of intervention. Our commitment to the children is not time-bound. We spend time building trust, co-create development goals, then stay with the children until those goals are met. This could be a matter of months, but often it'll span years to prepare for and support transitions. But I'm getting ahead of myself. At Zone West, we first support children to develop emotional literacy so they understand who they are and how they feel, allowing their inner voice to be free to express what they want and what they need. Link workers regularly discard a planned session, I've done it myself, to focus on a more pressing issue that a child brings that day. Our overarching aim is to hold children at the centre of everything that we do, empowering them to find their own solutions. To do so in the school setting, link workers develop trusted relationships with the children through one-to-one mentoring and group work. Small group work allows an exploration of physical and mental health and well-being, social communication and learning, both academic and life learning outside of the classroom. We find that children can often recite in a rote fashion what they should be doing to, for example, improve their physical health. Eat 5 portions of fruit and vegetables, drink lots of water, get outside and exercise, pretty much what we say to ourselves, but cannot speak to what that actually means for them. So we create a safe space to discuss whether they actually can access fresh fruit and vegetables. Do they feel safe to go out and play? Are they able to attend out-of-school activities? And if not, how do we change that? We also receive direct referrals from GP practices, and here the process is a little different, as link workers have to go through the caregivers to access the children. Caregivers will therefore usually bring their own or family issues, meaning the cases become more complex. During school holidays, we run play schemes and activities, funded by the Holiday Activities and Food Programme. Here, children can practice skills learned in their one-to-one and small group work in interaction with children that they haven't ever met before. New friendships are formed, new skills are learned, and the children cook their own healthy lunch, giving them the opportunity to try a wide range of different ingredients. Zone West is also a research project, and I'd now like to hand over to Dr. Jenna Charlton to talk about the impact data and the underpinning theory that ensures our work is evidence-based.
Lovely. Yes, hello everyone. Lovely to be here. My name's Dr. Jenna Charlton. I'm a research associate at Newcastle University working in speech and language sciences, but my background is in developmental psychology. And I'm the impact lead for North East Wellbeing, who developed the Zone West model. Now, the Zone West approach is underpinned by a theory of change that draws significantly on attachment theory. I think we're all very well aware of the importance of a secure attachment for children to be able to thrive and to access and explore the world around them. So our link workers, through attachment, work to facilitate and support the children one-to-one in school or in small group sessions. And that attachment relationship, which is secure and it's trusting and it's consistent, allows children to feel comfortable enough to express themselves, and they can work then collaboratively together with their link worker to meet developmental goals. So for us, attachment really is the catalyst to change in our children, and we think it's the catalyst to the positive outcomes that we see in our evidence and our data. which I'll speak to now. So we are really keen that everything we do with our link workers is evidence-based. So we continually collect quantitative and qualitative data to evidence the impact that we're having on children and on families. Here we've just got a snapshot of our data from last year, from 71 children. We collect a lot of demographic background information about children's development and their health-related behaviours. But our primary outcome is children's social, emotional, mental health and well-being. These are all children who score high or raised on a questionnaire called the Strengths and Difficulties Questionnaire, which measures social, emotional, mental health across 5 scales. So it considers emotional well-being, conduct difficulties, hyperactivity, peer relationships, and then their pro-social behaviour as well. So we collect data before they start their work with a link worker, and then around about 9 months in, after they've had 9 months of support. The SDQ is completed by parents and by teachers, and when we run our statistical analysis on this, we see that we have a significant impact on children's total social, emotional, mental health difficulties, on their conduct difficulties and their hyperactivity, and also on their pro-social behaviour as reported by parents. So this is really important, insightful data that we have. Next, we also measure the impact we're having on children's quality of life, and we use the Paediatric Quality of Life Questionnaire to do this, and our parent report shows that children have a statistically significant improvement in their emotional functioning and their school functioning based on parent report. We also collect language and communication data. Because I'm a speech and language scientist, I'm all very aware of the relationship between language and communication and social, emotional, mental health difficulties. So a lot of our children have unidentified language difficulties, and we find that we're having a significant impact on children's language and communication. And importantly for schools, we've just begun to work with secondary schools in the West End of Newcastle as well. And we've found that we're having a significant impact there on children's attendance when compared to matched control data. So that's some of our quantitative outcomes, but we do collect case study information, feedback and qualitative data, and Claire is now going to speak to one of our case studies about one of our Zone West children.
Thank you. I think the following case study exemplifies why social prescribing works so well for children. This young person joined Zone West in primary school. They're of mixed heritage, speak 3 languages with English as their 3rd language, and experience racism in their home country. Unfortunately, teachers displayed cultural misunderstanding and unconscious bias against certain behaviours and showed little empathy for the difficulties associated with navigating the English culture, particularly in school. Their link worker identified training from Show Racism the Red Card, aimed at creating light bulb moments about lived experience of racism to change behaviour. School implemented the training for both staff and students. The support continued into high school, with the young person seeking the help of our secondary school worker to address incidents of bullying. Their confidence increased through developing strong friendships within their new therapeutic group, and they have developed creatively through being linked to a local theatre company to complete a writing course. There were some heightened behavioural issues in school, and Mum disclosed domestic violence as she wanted to explain that there was a reason for the anger. The link worker made a children's social care referral and worked alongside the social worker throughout the move, first to a shelter and now into their own home. The young person experienced low mood and identity issues related to not knowing how to explore their cultural heritage. So a referral was made to Streetwise for specialised intervention and access to the Level Up project, which empowers young men from the global majority to talk about mental health and racism, challenge stereotypes and create change. Ongoing work with this young person is around critical thinking about online information and conversation, following discussions with their link worker where the young person made homophobic and transphobic comments due to strong arguments and opinions they had encountered online. The importance of this work is that the young person has felt safe to bring these contentious topics to their link worker to hear the other side before making up their mind.
So we just wanted to end our talk this afternoon just on some firm recommendations and learnings based on what we've learned over the last few years delivering Zone West. So we know it's really important that children's social prescribing link workers must be the child's link worker. They're not a family support worker, and they're certainly not there with any other agenda other than to support the child directly. So that is really key for us, that's held. The child is held at the centre of everything we do. We would advocate that children's social prescribing is continually evaluated to ensure that we are delivering the best evidence-based practice. And actually, whereas adult social prescribing has quite a lot of evidence-based, child social prescribing doesn't. It's relatively new compared to the adult models. Children's social prescribing needs adequate and long-term funding if we are to achieve systemic and societal change. The Zone West model we would advocate is rolled out wider across the city. We are currently working into 10 schools, one of those being a secondary school, mainly primary school, and our schools absolutely love it. So do the parents, and we have all of our teachers who would advocate and vouch for us that this should be a model that is in every school. And finally, we are increasingly working with children who are waitlist children for SIPs or mental health support services. We know, of course, that waitlist is ever growing, and we think there is room maybe to just adapt the Zone West model to work specifically in that waitlist space, because we know that we'll be having significant outcomes for SIPs and mental health services by working in that waitlist support area. Thank you for listening.